Doctor striking is a very sensitive issue. On the one hand, you've got doctors asking for fair pay, better working conditions, and the resources to be able to give the patients the care that they want to. On the other hand, when people strike, you've got delays, people extending waiting lists, people who are waiting for treatments, not getting access that they need, and having delays. So the ethical tension is clear. How do you balance a doctor's right to strike with their duty of care to their patients? In this, we'll go through all the elements for when you get asked a question like this, how you go about answering it in a structured way, and I'll give you a sample answer at the end. Sorry, there was a brief pause for a coffee delivery, but we carry on. So when you get these questions at interview, you are not expected to be a politician, but you do need to give a balanced answer. And the 4 pillars framework is fantastic for doing that. Remember, non-maleficence, it's important to remember the non part. So do no harm. Beneficence, do good to patients, basically help them. Autonomy, respect their right to choose and have a say in their care. And finally, justice, making sure that treatment is fair and equal for everybody. But remember that fairness and justice applies to doctors as well, that they're getting fair treatment for their work. So the key for this is balance. You don't want a simple yes or no. You need to show that you understand that it's nuanced and it's delicate, and approach both sides empathetically. Now, here's the thing that a lot of students miss. They don't appreciate that this is a problem of a wider system. Strikes don't happen in isolation. They reflect structural issues, problems over time, problems with staffing, pressure. Then that causes difficulties with providing the care that people want to give to patients. So it is just a reflection of a bigger systemic problem. So what does a good answer sound like? So if someone said to me, should doctors have the right to strike? I would start with something like, this is a complex issue and one that is representative of a broader systemic problem. Of course, doctors want to give their best care to their patients, and they feel that the conditions, the pay, and all the fairness around that is preventing them from providing that. From a maleficence point of view, we have to be careful that striking does cause delays, and while we have put measures in place to ensure that emergency care and people who really need attention are being dealt with, we are causing delays in the more non-urgent stuff, which is causing harm in some extent in the way that people are suffering, but also maybe that they are getting delays to things like if they are unable to work because of an issue that they're waiting to be resolved. That is causing harm in a more kind of expanded way than we might think directly than the people suffering. Overall, I would say that strikes are justified in extreme circumstances, and sometimes the benefit of them is to make things better in the long term, to benefit patients in the long run as well. However, we must balance this by making sure that at the same time, whilst we are striking and making our point and making the changes that we need, that the emergency care and that patients aren't having unnecessary harm done to them by people not being present in the system to help them. Notice how this answer doesn't sit firmly on either side. It shows empathy for both doctors and patients in the situation, and recognizes that it's a nuanced and complicated issue, and shows the ethical pillars that we are aware of as we go along. So what do you think? When you give this answer, do you think doctors should be able to strike? We'll be on a scale of 4 against, somewhere in the middle, and shades of grey in between. Where will you lie on that continuum? Pop your answers below and I'll tell you whether you are on course to giving a good answer or not. But if you would like some more interview support for your application to medical or dental school, check out this video where we will show you exactly what you need to perform well at interview. Thank you for watching, and I'll see you in one of those videos.